Hi, I'm Dr. Olga from the Gentle Foot Care Center, and as many of you know, we treat sports medicine in our office, besides the whole gamut of podiatry. Now, I have a particular interest in being here today for the AlterG at Cora Rehab with Kim Price and Jeff Lidinsky. I'm a marathoner, I'm a triathlete, and having had injuries in the past myself, I know how limiting this can be. The exciting part of all of this is we have the same technology, the same advanced medicine as our pro football players are getting, the same therapies they're getting, and it's available to our community here in Highlands County. And it's something on the rare side. You can't just find it everywhere in Central Florida. We're one of the few places. Kim, can you tell me how this will help my patients? Maybe they've had plantar fascial surgery, heel surgery, or they've got a tendon issue. How can I get my sports medicine, my athletes back into training?
Sports, yes.
Back on their feet and in the game.
The AlterG uses air to suspend you, which allows you to minimize your weight that is going through the feet. So it can start the person back to walking and running because we can control their body weight. And then we can gradually increase their weight back to their body as their area that's healing gets feeling better.
Well, years ago, we only used to be able to offer our patients, get in a pool, like at the local YMCA, and do pool running. So now, while they're still in their cam walker boot, they're still rehabbing from a surgery, or let's say they've had an amniotic injection for a tendon tear, we can already start utilizing the therapy. There's not going to be the traditional downtime.
Correct.
We can take 80% of your body weight away. The difference between this and a pool is that there's no resistance. In other words, it's normal walking. You don't have to slodge your legs through the water. Rather, you have free movement of the legs as you would walking. So it's direct simulation of walking.
You can take 80% of my body weight off.
80% you could
I didn't
float.
have to do a diet. I didn't have to anything. I'm going to be floating. I'm going to feel like I'm on the moon.
You are going to feel like
Now
you're
that's
on the moon.
cool.
Yeah. Along with the traditional therapies that we offer, this is a good supplementation as we reintegrate their therapeutic activity. In other words, they can run with less weight, so therefore there's less force on the injured areas. And the beautiful thing about this is whether they're an athlete, a triathlete, or they use an assistive device, we can use the AlterG, help them get back to normal walking, progressing as far as possible.
Now, what I'm also really excited about is for our patients here in Highlands County, for our community, is we've got a lot of golfers, a lot of retirees that come down here to golf, and also people who are having some balance issues. We're having people with Parkinson's. This is not just for elite athletes, right? This is for the whole community to improve their walking, to get them back out into their daily activities. So somebody who's at risk for falling, so some of our patients who are out there, if you're at risk for falling, if you're having issues where you've already landed in the ER, in the hospital, or trying to avoid a nursing home because of your balance issues, this would be a great path to deter that.
Hold on to the gray, because what I'm going to do is I'm going to show you how you get out of this thing. Is we're going to just lower the bar, everything drops out, and then what we'll do is we will step out of the machine.
Well, thank you, Kim. Thank you, Jeff.
You're welcome.
Thank you.
This is awesome that we have this modern medicine, that we have this technology right here in our own little Highlands County. So if you're having foot problems, this may be one of the type of therapies that I incorporate to get you back on your feet. Not just for our athletes here in town, not just for our marathoners, triathletes, or maybe our middle school or high school kids who have had an injury, but I think this is great for our patients with balance issues, maybe somebody who's had a stroke that needs to have gait training incorporated, as well as our patients with arthritis or might need a brace to wear. The great thing is I see that this expands through all the different specialties. If a general surgeon's looking to do gastric bypass or a lap band or any other type of surgeries, a person could come in and see what they're going to weigh. Or if they're having knee or hip problems, your orthopedic surgeon will be referring them here. So thank you for watching this, and if this is something you feel that will help you with getting you back on your feet, we're here for you. I'm Dr. Olga at the Gentle Foot Care Center, and thank you so much to Kim and Jeff from Cora Rehab Therapy for inviting us over today.